Hi, my name is Michell Virgi, an optometrist from Eye Care Consultants in Nairobi, partnering with Ponea Health. Today we will be talking about refractive error. Usually when one notices a refractive error or blurred vision, the first thing to do is to bring yourself or your child in for an eye exam. The eye exam is relatively simple. We will first see what you can see without any correction, and then we will put you on a machine that will give us a computerized result. After we have that computerized result, we then take you through a series of tests to confirm whether you will need glasses or not. For young children, if it's their first time or they have relatively high numbers for their glasses, we perform something called a cycloplegic refraction, which is when we put eye drops in their eyes to relax their eye muscles. The effects of these eye drops usually last about a day. It's nothing to worry about, but they will not be able to see things that are close, and they will be very sensitive to light. But this usually gives us a very accurate reading for their eyes. A lot of people think that there are some home remedies that they can do in order to treat refractive errors. There is no such thing, unfortunately, because refractive errors are now due to the shape of one's eye. So as a child is growing, the eye also grows, and if it grows too long, that can cause short-sightedness. So no matter what home remedies you do, that will never really change the shape of your child's eye. And it's also important to remember that when your child is given glasses, the glasses are not going to make the eyesight worse, which I think a lot of people are worried about. The glasses actually help your child to see clearer, which will help their productivity in school. And regardless of if you wear the glasses or not, the number will increase till they're about 18. Due to our current lifestyle, we spend a lot of time on screens and mobile phones. And like I mentioned, due to that, we're finding a lot of children and young adults are becoming short-sighted. Now that is something that can be prevented. With young children, they should not be spending more than 2 hours a day on a computer screen. And if you are a young adult at work on a screen, every 20 minutes you should take a break. We have a small rule, whereas every 20 minutes you take a 2-minute break, and just to focus on something that is further away, just to keep your eye muscles a little bit more active. After the age of 40, there's a structure in your eye, it's called a lens. So it's like a camera lens. So the lens is surrounded by muscles. So when looking far and looking close, those muscles readjust the focus of the lens. So it allows you to focus at something close, and then it allows you to focus on something far. After about 40, those muscles become a little bit weaker. So it cannot focus on anything that is close. And that's just a natural aging change of the eye. There's no real preventative measure that can be done about that. The important thing to take home is that when you do notice that your vision is becoming blurry, not to ignore it. A lot of people tend to forget about it, or they hold their book a little bit further away to try and focus, but that can lead to headaches and eye strain. In terms of your spectacles, most people tend to prescribe plastic lenses as they are more durable compared to glass. Again, glass is a very heavy material, and if dropped, it can shatter. So usually we prescribe plastic lenses. Of course, with plastic, they can scratch. So whenever we do give you a pair of spectacles, we will provide a cleaning cloth as well as a cleaning spray that you will use to clean your lenses. And this should help prevent scratches. People that wear contact lenses, hygiene is extremely important. We have to remember that a contact lens is something that is going in your eye. So if your hands are not clean, or if the solution that you're using is not clean, it can cause eye infections. Sleeping in your contact lenses can cause a lot of eye infections, and also swimming with contact lenses can lead to infections. When you do come to us for contact lens fitting, we will go through the whole procedure of how to put the contacts in, take the contact lenses out, and how to care for them as well. So for young children after the age of 5, it's very important to bring them for yearly eye exams. Firstly, if they have a family history of any refractive error, the chance of them also having a refractive error is high. And also with children, they don't understand what clear vision should be. So if they are seeing blurry, it will be very difficult for them to communicate that with you. And it will result in difficulty at school and not focusing well, which can sometimes, like I said, be misdiagnosed as a learning difficulty. So it is very important every year that we test any child over the age of 5 and up to the age of 18. Thank you for joining us in this discussion. You can book our services through ponea.com, and we look forward to engaging with you in the next one.